Hi, I'm Katrina, and this is Boldly Challenging Ableism. I'm your host, Katrina Simons. I'm the Community Program Specialist at the Institute on Community Integration at the University of Minnesota. This program explores various topics that impact people with disabilities in our community. Each episode addresses a different aspect of our society within the context of ableism. Ableism is the prejudice that stems from the belief or belief system that assumes someone is less capable or less worthy because of a real or perceived difference in ability or function. On this program, we hope to answer some questions you may have been afraid to ask, or maybe some you didn't even know you had. Thanks for joining us. I hope you enjoy the conversation. Hi, everyone. Welcome to Boldly. My guest today is Sarah Ailey. She's coming to us from down in Chicago. Thank you for joining us, Sarah.
You're welcome.
Can you tell us a little bit about yourself?
Sure. So I am an older woman, and sort of light blondish hair, such as I have hair, I've got on a green shirt, and I am a nurse. I'm also a nurse researcher, and I have a middle-aged son with intellectual disabilities, which is what brings me into this world and inspires me to do things. I'm happy to talk today about my experiences.
And how long have you been in that field?
A long time.
You don't have to share as much as you feel comfortable sharing with us is fine.
I've been a nurse probably about a little over 40 years. Okay. But at some point, partly because I wanted to do something about the lives of people like my son and the experiences of people like my son. And I should say that, my son he started school when he was 3. This was only just like a few years after what was at that time the Education for All Handicapped Children Act got passed. So that made a big difference in our lives, that he was able to take advantage of that policy change in society. He also was in Special Olympics from the time he was about 8, which was a little over, say, 15 years in for Special Olympics, which made a big difference in his life and our life, and the family's life, because, it allowed him to be active and out there and going to games and so forth. And I know you're having the Special Olympics World Games in Minneapolis right now.
Yeah, we were just talking about this. We think they started yesterday.
Yeah.
I was going to volunteer, but by the time I got to the website or whatever that you're supposed to volunteer at, they only had early mornings left, and I am not your early morning person. I will close your day. Even if you stay up till 4 a.m, I will close your day. I am a night owl. So it doesn't look like I'm going to make it as a volunteer, but I might get to go see some of the games. We'll see. What sport did your son play, or what sports?
More than one. He didn't like tennis, and he didn't like gymnastics, except for jumping on across the horse. He liked any of them. He really liked, I think, the floor hockey and basketball were probably his favorites. I'd have to say probably when my grandmother died and everybody was there for the funeral, and that generation of kids, he was the oldest one of them, but he was close in age to several of the others. Mm-hmm. And we all went over to the park, and they were playing softball. And so he just played softball because he had been playing softball with Special Olympics. He knew how to do it. Nobody really cared if you hit the ball or made any points, because it was just family get together. And I said, it makes a difference that he knew how to do it. He just joined right in, and he was there with all his cousins.
That's so nice. Oh, I love that. And were you a nurse first, or were you a parent first?
I was a parent first. Okay. I come out of the 60s, so I was involved in community organizing. And at some point, I decided that I couldn't be all that I did. And I went back to school, and I got first my AD degree in nursing, and then I went and got my bachelor's. And then I was really interested. I thought I might work in setting up a clinic for people like my son, and then they got their claws in me, and I just stayed and got a PhD too, which has really led me in directions I probably didn't think I was going in at the time when I was going for those degrees, but certainly has put me in a position to influence how healthcare and policy go for people like my son.
And do you think if you hadn't had a child with a disability, do you think you still would have wanted to be a nurse?
Yeah, I think in my early life, I thought I was going to be a physician. So I think I probably would have ended up in healthcare some kind of way.
Okay, so and can you just give us like a either like a order of events of projects that you've worked on, like topics, or like a time frame that you've been working specifically in nursing and IDD? Either one of those is
either
fine.
One of those.
Yeah.
So I'd say that, in the earlier period of when I was a nurse, I was in home care.
Okay.
I worked in a hospital briefly.
Right.
But I don't like being in four walls particularly.
Yeah. I think they have you work in the hospital so that you get that experience, and then you can kind of go do other things. Was that your experience?
That's what we usually suggest students do.
Okay.
Is that they work in a hospital for a couple of years, get experience.
Okay.
And I worked in home care for a number of years. When I first came into home care, actually was in the early period of the AIDS epidemic. We had absolutely nothing. Mm-hmm. We had nothing except try to treat whatever came up. We had, antibiotics. And so maybe that leads somewhat to how I view issues with intellectual disability. But at that time, there was no mention that there was an AIDS epidemic from the federal level. It went they just ignored it. People were, and for the most part, I was dealing with young men who were my age or younger who were dying, and we had absolutely nothing. And there was so much discrimination against them at that time. Mm-hmm. So it's certainly colored how I experience ableism, I think. And at a certain point, probably this would have been as my son got somewhat older, and I was, he was in school, so I was less tied to, having childcare responsibilities. I also have a daughter who's 5 years younger than my son. Okay. They got old enough to be in school, and I decided I was going back to school so that I could do some things about intellectual disability and other people who face all kinds of discrimination. So, like I said, I think I was interested in establishing a clinic for people with intellectual disabilities. Then I went and got the PhD. Then I got into research and program development.
Okay, cool.
That helps on the time.
That does help. Okay. So, and the clinic would have been primary care or specialty care or both?
I think I was thinking both.
Okay,
yeah.
Cool. What unique needs have you seen in the IDD population that you might not see with other populations?
So I would say, on the one hand, they're sort of unique needs, but they're not. Their needs and interests are pretty much the same. I think everybody deserves person-centered healthcare. Responds to their needs. That helps people to, there's something in aging, called 4M framework, which has 4 things. The first one is what matters to the person. So dealing with their unique needs so they can do what matters to them. That they can be part of their communities, their families, whatever matters to them. And when it comes to intellectual disabilities, the effects of ableism are pretty stark, and in ways that people might not express it if they were talking about other disparaged populations.
Right.
And certainly there can be, many people have communication needs, and have sensory issues, not just with intellectual disabilities, but it's probably more concentrated. Might you say that it's, that's kind of one of the defining aspects of the disability anyway, that you might have communication needs. And certainly we don't prepare healthcare professionals to deal with that. one of my areas of work has been in trying to educate healthcare professionals in the health and health care of people with intellectual disabilities. And basically, none of the major organizations that set accreditation and education standards, they don't require anything. I say dentistry does, but the others don't. And if providers got any education, they probably got it in a PEDS course.
Yep. Yep.
So they don't have any whatever with people who are older, aging with disabilities, aging with intellectual disabilities. And so they're not prepared. And nobody's requiring that they be prepared either.
Yeah.
I had something in my notes talking about ableism. So a few years ago, 2021 or it was 22 that it came out, there was an article by Lisa Iazzoni where they did a survey among physicians, only physicians, but physicians. And one of the questions was, would you be very willing to have people with disabilities in your practice? And it was like something like 56%, or it was less than 60%, who said they were very willing to have people with disabilities in their practices. So I don't think they would outright say they weren't willing to have people who are Black in their practices. They might do other, but they were quite willing to say they are discriminatory. And then they did a follow-up focus group. And how do you do that? They said, well, they refer people to specialists. So I was at a meeting where somebody was talking about her daughter who has some particular like facial issues.
Yeah, like craniofacial concerns.
Yeah, they would go to an ear, nose, and throat specialist. And the daughter was, I think, 16 or 17, well, not yet 18. So the adult people said she should go to PEDS. The PEDS people say, she's basically an adult. She should go to adult. So the upshot was, and the primary had said go to a specialty.
Right.
So the upshot was she couldn't get any services.
Right. So there's a new field of study, and it's called transition medicine, and it looks at how we can support people living with IDD to move from childhood to adulthood, particularly in the healthcare realm. We're working on it in other areas, but really the field of transition medicine is unique to medicine. Do you think we're asking the right questions within that field? Do you think we're doing everything we can be doing? And what is missing?
Well, I have to say, as a nurse educator, I work with a lot of doctor of nursing practice students on their projects. I don't know how many I looked at when I was on a course where we were reviewing the first drafts. One would be on transition from PEDS to adult for people with cystic fibrosis, sickle cell, cardiology. It's a universal issue. Down syndrome. It's a universal issue, and so again, I would say the adult care providers, if they got any education in intellectual disabilities, they probably got it in PEDS or PEDS experience. I think most of the literature on health issues, say around people with autism and so on, is looking at children, not adults. I was at a conference where there was a woman who did a review of literature on health issues among adults with autism over 50. I almost fell on the floor because I said, no one talks about adults, much less older adults.
Right.
They talk about children.
Right. And if you do it, you're like the one study. So I was like, oh my gosh, I was shocked. And this is the only person I'd ever, met who said I'm looking at adults over 50. So they don't get educated to deal with adults. I would also say, I'm maybe digressing a bit, but I am a nurse educator. And we use, at my institution, we use American Association of Colleges of Nursing Essentials. And they came out with a new set of essentials in 2021 and upgraded it this year. And they talk about that they're trying to prepare nurses to practice across the continuum of care and across the lifespan. So that would be, the continuum of you need, health promotion, preventive care, you need primary care, then you need acute and rehab care, you need
chronic conditions care, especially as people get older. You get to be my age, you got chronic conditions. Pretty much. That's pretty much 100%. And then, end of life palliative care. So, and for a long time, nursing education and medical education is largely focused on acute care and not those across the continuum. And as we said, if they got any education, was more in peds and not across the continuum into like chronic conditions care and so on. And how they describe all that is just flat out ableist. I've read the document and it says that health promotion and preventive care is for generally healthy populations. And I'm not sure who those folks are.
Right, because nobody stays healthy there. I mean,
I probably got 6 or 7 chronic conditions, but I would consider myself generally healthy. They may
right.
But sort of by default, it eliminates people with intellectual disabilities or disabilities in general.
Right. I mean, and it also, it sort of eliminates everybody who would be more work to care for. So thereby we're making our scope easier by leaving out the people who need more help.
There's almost no scientific, we would call scientific literature on health promotion among people with disabilities. They don't need it, right?
Right.
I mean, I can remember I worked on a study where we were looking at, had to do with health promotion among people with Down syndrome, but there was a larger one where they were really working on exercise and nutrition with people who had some serious, they'd had strokes or they had mobility issues. And there were people saying, why are you bothering? And the guy who was running the study was because, it's because. But there's flat out labels, why would you bother?
Right.
And so, and then when they talk about management of chronic conditions, it just says it's to reduce secondary problems. Well, of course, that's an issue. But
that's not why you do it.
The main point of why you do it is so that people can do what matters to them.
Right. Or so that they don't die. Like either one. But it's not just to make a mark on your piece of paper.
Some of the advertisers get it right. To me, there's a great ad for portable oxygen machines.
Yeah,
and the guy says he loves softball. And then they have him out there, an old guy, playing softball with his buddies. And he's got the oxygen machine strapped to his back. And he's pitching the ball. I said, there it is. And so you can do what matters to you.
Right. So you can do what matters to you.
Right.
Or be with the people who matter to you for as long as it matters to you. Yeah. So we're having many, many, many more people with very significant health challenges that used to be life limiting live longer. What are you seeing now that that's happening that's surprising you or that you'd like to see changed?
So maybe because I came out of home care and we dealt with people who had many people who had long-term chronic conditions. But I guess it does surprise me a bit, although I've been around a long time, maybe that I'm not as shocked as I should be. But the whole notion that, like this thing, like I said, with AACN, American Association of Colleges of Nursing, that is just to reduce secondary conditions. Or there was a controversy during COVID a few years ago when it was was she the Surgeon General? Whoever it was, at the CDC, I think.
Yeah.
That she said that it was good news that the people who were dying of COVID at that point either hadn't been vaccinated or they had they had a lot of chronic conditions. That's not good news.
Right. Like, I think, okay. I can see where she was going with that. Like, I think she's saying, so, like, most people won't die, but, like, what about those of us who will die?
Rather than say, most people who are dying have chronic conditions, which means we need to put some extra, precautions in place and do more to work with that population. It was just that was good news. And both the disability rights people and the anti-racist rights people were pissed off.
Like, yeah.
And because it just assumes that, it's fine.
Right. Well, and mine was, again, maybe I'm biased because I am a recipient of home care, but mine was that, like, the most people who are dying of COVID live in a nursing home. But I was like, but if you've got 10 college students coming in to you on a weekly basis, you're just as much at risk as someone who's in a nurse, not just as much, but higher risk than average people. So it wasn't like all the people who need our help are contained, which is the message that they wanted to send out.
Well, my son lives in a group home, and there was a study that came out of the my senior moment, one of the USAIDs, and I could come up with the names, and that this is a very risky group. People who lived in group homes. This is a small congregate setting. Yeah. But when the study Landis and them, when they published the study, intellectual disability was the strongest predictive factor of death, other than age, of COVID. It was also a very strong predictive factor of getting it. And in Illinois, where I live, they specifically said they weren't tracking COVID in group homes. Right. Tracking it in nursing homes and the larger facilities. Yeah. We have a couple of state institutions here. They were tracking it there, but they weren't tracking in group homes. So you don't track data. You don't have any outcomes that you can look at. Right. So I go, but these people,
And then again, you don't have to look because you don't have evidence.
You don't have to look. Certainly, my son's home in November of 20, everybody in the home had COVID. Everybody tested positive. And I have to say that the direct support professionals, that profession, pretty much saved the group home settings in that era. Because his home, and I talked to people at other agencies, there was a staff person who stayed for 24/7 for 14 days.
Jesus. I hope they got to bill overtime.
I'm sure he got a nice overtime.
I really hope he did. Because some of them won't let you bill overtime. So I really hope that wasn't the case.
I think you can. I don't know, Illinois.
Okay. But, it depends on the state. I'm just saying.
There was a whole special on a guy who locally covers whatever scene, another group home with another agency where not only everybody, all the residents, but the staff in the home all had COVID together. Yeah. And that staff person stayed sick with them. I guess she wasn't that sick, but for 14 days while they were all in quarantine. Yeah. And
that's so nice.
Yeah, it is.
And it shouldn't have to be that way.
And they're a very disparaged population themselves. But I'd say, that group of of workers, they kept those settings going during COVID. Because this was seemed to me when I talked to other agencies, that's what they were doing. They didn't want all kinds of staff going in and out and also getting infected. But they had to have staff there. They found somebody who was willing to be there. Those days, it was a 14-day quarantine. They stayed there for 14 days. Yeah.
Okay, well, we're almost out of time, so I got 2 questions left. Okay. What are you worried about in relation to the looming Medicaid and Medicare cuts?
Well, I'm worried. I'm worried that they're cutting back on what families can, receive as far as under the home and community-based waiver systems.
Well, and in Ohio, they it didn't pass, but they put it up to pull family caregiving altogether.
Right. They're talking about pulling it all together. Yeah, but now putting special education outside of the Department of Education. I think they want to get rid of it, unfortunately, or way cut back what you can get in special education. So there's a lot of policy issues going on right now that would go back on the sort of rights and services people have attained over the last.
So you're worried about going backwards?
I'm worried.
Me too. All right. What do you want people to do or say to support people with intellectual disabilities getting the health care they deserve?
I would say one of the things is to speak up and speak out about it. I certainly would like to see more, I guess you could say, stories from people, their experiences, both good and bad. We don't have to just hear the bad. But, like I was saying with the woman, with the daughter with the craniofacial issues, by the primary saying go to the specialist, and either some specialist wanting to see her, you can't get services. That's how that's practically what Iazoni was talking about in her articles. That's how it happens in the real world. We need those stories out there, and we need the good stories out there. Yeah. And so I'd say, if anything, speak up
Yeah.
Get your stories out there and certainly get involved in the policy and legislative issues.
Right. Use your voice.
Quite important. Use your voice.
Yeah, because some people can't, and so they need yours.
Yeah.
Like herd immunity. Some people can't get vaccinations, so they need yours.
Right.
Yeah. All right. Well, this was delightful. I hope next time you come to the Twin Cities, you'll stop by.
Well, I'm hoping to get there soon. I like the Twin Cities.
So if you get there and you come to Mid-B, if it's Monday or Wednesday, I'll be here. But if not, you could text me.
Okay.
And I don't know. We could meet for coffee or something.
That would be great.
All right. Well, it was lovely to meet you, Sarah. Thank you so much for your time.
And you're very welcome. I'm glad we got a chance to talk. And please, everyone, do speak up.
Yeah. Have a wonderful rest of your day.
Boldly Challenging Ableism is a co-production of AM 950, the progressive voice of Minnesota, and the Institute on Community Integration at the University of Minnesota. For more information, please visit ici.umn.edu.